One of the most common things I hear from expectant mothers at Guinea Savannah Medical Center is, Dr. Phillips, I really want to have a natural birth. We are also aware of various stories that puts pressure on women to have natural birth, which means vaginal birth. But as we move through the journey of pregnancy, we have to remember that the ultimate goal isn't just a type of delivery. It is a healthy mother and a healthy baby. Sometimes the safest, most responsible path to that goal is cesarean section. Today, I want to pull back the curtain on this procedure. We are going to talk about the medical markers that tells us a cesarean section is necessary and why it is a life-saving tool rather than a plan B. Understanding planned necessities. Not all C-sections are emergencies. Sometimes we know weeks or months in advance that surgery is the safest route. The first reason is position. By the 36th week, we look at how the baby is lying. If the baby is breech, that is coming with feet or transverse, that is lying across, a vaginal delivery carries a high risk of the umbilical cord prolapse or being compressed or the baby getting stuck. The second reason is placenta issues. If the placenta is covering the cervix, a condition called placenta previa, it creates a physical barrier such that the baby cannot pass through the vagina. In this case, could cause life-threatening bleeding for the mother. The third reason, previous surgeries. If you have had a classical cesarean section, which is very rare now, or a major surgery to remove fibroids, which can mimic the classical incision, the walls of the uterus may not be strong enough to handle the intense pressure of labor during contractions. In these cases, we plan a cesarean section to prevent uterine rupture. When labor changes the plan, the cesarean sections that happen after labor has already begun. This is where many women feel a sense of disappointment. Failure to progress. This is the most common reason for an unplanned cesarean section. You are dilating, you are pushing, but the baby isn't moving down. Your cervix might stop opening despite strong contractions. We don't rush this, we give it some time. But if labor stalls for too long, it can lead to infection or exhaustion of both mother and baby. Fetal distress. During labor, we monitor the baby's heart rate. If we see the heart rate dropping significantly, especially below 120 beats per minute or above 160 beats per minute, it doesn't bounce back after a contraction. It tells us the baby isn't getting enough oxygen. When the baby tells us they are struggling, we listen. This is known by increased fetal heart rate or reduced fetal heart rate, and we do this by listening, and this is what requires immediate cesarean section to rescue the baby. Maternal health factors. Sometimes the necessity isn't about the baby's position, but the mother's health. Preeclampsia is a mother's blood pressure spikes to dangerous levels during labor. It can lead to seizures, convulsion, and organ damage. If we cannot control the blood pressure with medication and the lady is far from delivering vaginally, then that labor has to be terminated and an immediate cesarean section has to be done for the safety of the mother and that of the baby as well. Yeah, active infections. If a mother has an active outbreak of vertical transmission like you see in HIV and hepatitis and herpes, cesarean section prevents the baby from coming into contact with the viruses in the birth canal. Cephalopelvic disproportion. This is a way of saying that the baby's head is too large to pass through the mother's pelvis. But when it happens, trying to force a vaginal birth can cause trauma to the baby's head or to the mother's pelvic. I want to take a moment to speak to the emotional side of this. Many women feel like they failed if they end up in the operating theater. I want to tell you, surgery is not a failure. In fact, a cesarean section is a means to an end. It's a complex, highly skilled procedure that allows us to navigate a dangerous situation and brings a baby into the world safely while saving the mother. At Guinea Savannah Medical Center, we focus on making your cesarean section a family-centered experience, and we ensure your recovery plan is as robust as your surgical precision. Your husband or first degree relative can be allowed into the theater. Whether you deliver through the birth canal or through an incision, the moment you hold your crying, healthy baby, that is the victory. If you have questions about your birth plans or the risk involved, come see us at Guinea Savannah Medical Center. I am Dr. Phillips.